The Senior Medicare Patrol is federally funded by the Administration for Community Living. And in Louisiana, we're sponsored by EQ Health Solutions. Our mission is to empower Medicare beneficiaries, their families, and caregivers to prevent, detect, and report fraud, abuse, and waste through outreach, counseling, and education.
And they're telling us out of the Center for Medicare and Medicaid Services in Washington that anywhere from 60 to 100 billion, that's with a B, is lost by fraud, abuse, error, and waste each year in this nation. That's an eye-opener. All I know is good medicine. All I know are physicians who practice good medicine, but there are some that are not, and there are people who will take advantage of your Medicare number and buy all sorts of things with it.
In Louisiana, we have over 800,000 Medicare beneficiaries. We have 3 full-time staff with a limited budget. It's a grant program. We have 46 wonderful volunteers, but 800,000 people to reach with the few numbers that we have to support the program is daunting. So volunteers are critical for us to reach the Medicare beneficiaries across the entire state.
We are looking for someone who is not afraid to stand up in front of a group and maybe give a 15 to 20-minute presentation on Medicare fraud prevention. They talk to them about protecting their Medicare summary notice, detecting fraud, waste, and abuse on their Medicare summary notices, and then how to report that. We're also looking for volunteers who like to work at health fairs, where they stand at a booth and they hand out literature, giveaways. We provide all of that information for them.
Well, in my particular case, I answered in an ad about Spanish-speaking volunteers for SMP. One of my favorite programs is Social Security and Medicare. The costs are very high, and incrementally every year it goes up higher and higher. And if fraud is one of the reasons, then I will do whatever is necessary to help. I can utilize my intelligence, my knowledge, my experience, my organizational skills, and if I don't have any of those, then I can acquire them because I'm dealing with people that are very capable. They are able to tell you exactly, well, this is what you can do, this is what's going to happen, this is the result. At the same time, some of the younger people are more knowledgeable about Medicare activities that I am not.
When that Medicare notice comes in, hopefully you can check the date, know the doctor that you saw is the doctor who's listed, and that the service that was given to you, you received, and the tests that you went to take, and the procedure, and even the hospital you were admitted to is accurate, and that you care. And if you find that it isn't, that's something you should take up with the provider, or either your plan, or if you're not satisfied with that, or you can't get an answer for it that's clear to you, that you contact the Senior Medicare Patrol for them to investigate. Because I think that not only is it fraud and abuse, it's also error and waste.
It's just very simple. Look at your bill. Now, I've been looking at my bills forever because it's my money, but your money, which is basically what I'm looking out for now, and you know, the federal government doesn't have any money. This is the taxpayer money that we need to watch out for.
We have found that retired professionals are a good fit for this type of work and the type of volunteers that are important to this program. If you feel that you can help us, we would greatly appreciate you calling our toll-free number, 877-272-8720, and talk with us. You can also go to our website, stopmedicarefraudla.org, and complete a questionnaire, read more about our program, or look at some of the testimonies from other volunteers and get more information about our organization.